Exercise, what effect? Improve cardiovascular function, promote self-esteem. Contents, object, plan, background, leisure the first semester experiment. Identify the purpose of cardiovascular function tester. Know, investigate the use of cardiopulmonary function checker. Create an item that you want to try the challenge. Experiment subject. Effect of exercise, cardiopulmonary function improve, raising self-esteem. Objective. Identify the structure of the cardiovascular function tester. Find out about the use of the cardiopulmonary function tester. Before and after exercise about 2 months to find out about improving cardiopulmonary function. Find out after the exercise for improving self-esteem. First semester. Identify the purpose of cardiovascular function tester. Know, investigate the use of cardiopulmonary function tester. Check my current state of fitness, cardiorespiratory function related. Create an item that what I want to try the challenge. Second semester, summer vacation. Exercise, August 1 to September 30, 4 or more times a week. Standard, fitness 1 hour, walking more than 8,000 walker. How to check between the holidays. Before and after exercise, take a picture and send to the entire KakaoTalk. If you did not fulfill your assignment week once, equivalent of 10,000 won gift count to send to group, and the others are same or much bigger. The second semester. Improve cardiovascular function to measure the degree by selecting one of the now oneness to have the college and do private practice. Background. Usually when I climb to the stairs, I feel hurt easily, and I'm pro of my breath. I am curious about my basic fitness. Therefore, I plan my experiment about how can I prove fitness and what is the index of better than. Commonly, we align positive effects while doing exercise regularly. Among those effects, we'll focus on difference of cardiopulmonary function and how it affects our self-esteem. The result of experiment. Identify the purpose of cardiovascular function tester. 1. Preventive medical function. 2. Whether the diagnosis of coronary artery disease symptoms. 3. The degree of deterioration diagnosis of coronary artery disease. 4. Diagnosis of arrhythmias. 5. The discovery of unstable blood pressure. 6. Postoperative prognosis. 7. Evaluation of the treatment process. 8. The basis of exercise prescription. Exercise test is used to accurately assess the cardiopulmonary exercise capacity of patient before exercise regimen. In particular, the exercise test in order to evaluate the safety of the movement is necessary prior to participating in the high-intensity exercise program. Measure the cardiovascular and cardiorespiratory health and fitness ability of the respiratory system. Breathing air measured oxygen intake and carbon dioxide emission, such as ECG. Now investigate the use of cardiopulmonary function checker. Previous test preparation. Whether to use any of the bike or a treadmill to the muscle first recorder must determine whether or not to the administration of oxygen, additionally whether to insert the artery catheter. Preparation in the test room. Calibration. The gyro calibration should be performed before each test in order to conduct the test correctly. In pneumatograph, temperature, water vapor pressure, since the check value according to the viscosity of the gas change, the gyro calibration should be performed under the same condition as when the test before performing the test. Preliminary test. Pulmonary function test to be carried out prior to the test. Most tests measure vital capacity, inspiratory capacity, FEV, maximum voluntary ventilation. Maximum voluntary ventilation may also be measured indirectly measured rate depth and fast per 12 seconds and multiplying by 40 the FEV. By measuring the maximum ventilation rate may measure the amount of the pre-ventilation during exercise. Equipment familiarization. Prior to the test, allows the person to be examined. It is important to be familiar with the test. If the test is treadmill, you need to make sure that you can climb the subject themselves on the treadmill. When doing tests, get person in custody to exercise maximally. Measuring by treadmill and cycle has some difference. Table 2. High volume mag and O2 pulse, treadmill plus, cycle none. Similar with VE maximum pulse, treadmill plus, cycle plus. Familiarity exercise, treadmill plus plus, cycle plus. Collectance in amount of measuring exercise, treadmill minus minus, cycle plus plus. Selecting the increment size, increasing load measure 10 minutes of necessary amount of exercising to maximum intake oxygen. 2. Lasting measures, attaching ECG leads to minimize effects of exercise attached leads like figure 1. 2. Lasting measures, attaching ECG lead to minimize the effect of exercising attached leads like figure. 3. Unloaded exercise and cycling rate. In no load 3 minutes, 60 times per minute, pedaling without pulse, measuring ECG BP. 4. Exercise stress testing. After 3 maximally exercising in load, measuring ECG intervaling 2 minutes. 5. Recovery pace. After exercising, bind mouthpass during 3 minutes and respirate 3 minutes. History at PFTS ECG. Next, maximal incremental exercise on a cycle ergometer. Next, familiarization symptoms. Borg scale. Next, cardiopulmonary measurement. 3 minutes resting, 3 minutes unloaded cycling optional, 10 minutes incremental per lamp exercise. Next, 10 minutes recovery, 3 minute unloaded cycling, ECG monitoring. Create an item that you want to try the challenge. Items that require college to know. Talk with foreigners that do not know and get SNS friends with them. 2. Create a chicken clip. Once we ate another chicken a week, posting review at neighbor vlog. 3. To participate in the half marathon 10 km. 4. Pre-hug places like City Hall or the flea market often for 1 hour in the event. 5. Bake the meat alone at the store.